Dr. Gerstenbluth, thank you for accepting our invitation. We have our readers, they've asked a lot of questions. And one of them was, why aren't we here in Curacao making mandatory a face mask wearing? Because we know, for example, from other islands that they do, especially when they're opening their borders, the visitors, and people who work on these islands. Why don't we make that mandatory?
Yeah. Thanks very much. Thanks for the questions. A long list of questions doesn't ensure that I have a long list of answers, but I will do my best. The face mask discussion is not over. This discussion has been going on like since the beginning, and it goes up and down, and it's going all over the place. And the last word about face masks has probably not been told. The truth is that there still isn't very clear evidence on what does not work, etc. So all people are saying certain things, but you must take into account when you look at the research that there are a lot of confounding variables. What does that mean? That you attribute the success of a measure to, for example, in this case, a face mask, but it might be concomitant with other variables that happen to be in place at the same time, and you attribute it to the face mask, but it may well be that there's something else going on because it was introduced at the same time, like lockdowns, social distancing, etc. So before you can really make good conclusions about what the added value is of face masks, is not all that easy. That's number one. But number two, to get back to the specific questions, yes, different countries do propose different measures or have different measures in place. And why didn't we do that in Curacao? Well, I think if you look around you, you will find the answer by yourself. We took very severe measures. It's not only us. Lots of countries did that, but the success is based on how people complied. So together, we managed to, if you keep distance from each other, if you do it very severely in terms of lockdowns, so you limit contact between people, you will notice that you limit all kinds of infectious diseases, so communicable diseases. That's logical. So if people aren't able to communicate with each other anymore, the ability to pass on a disease from one person to the other also diminishes severely. So what we've been seeing since in the period of lockdown, that not only did we manage to ensure that there was no transmission of COVID, but there was hardly any other infectious disease being transmitted also. We have a syndromic surveillance on the island, so we know that normal respiratory symptoms were also not passed on. Gastroenteritis, so diarrhea, vomiting, other infectious diseases that are commonplace also in that period, they were all near nil. So the effect of limiting contact between people, of course, has the effect that you're going to limit transmission. If you successfully limit all transmission, you will see that in your figures, and you remember that at a certain point for weeks at end, we were reporting that there were in total 16 cases. Week in, week out. We did that for 5 or 6 weeks, and then it started increasing again. And what was the increase? Those were all import cases that we detected during quarantine, and people were kept under control. We knew who the contacts were. We were able to trace all of those, and we kept it so that it didn't translate into increased local transmission. So where am I going with all of this? We managed together to keep the local transmission down to virtually non-existent. So it's either very low or non-existent altogether. So if you determine that you don't have any local transmission, you do not need to wear face masks. If we're walking outside, I think the constant wind we have trade winds that are going in the same direction. They're always there. They're almost always there. There's one month of the year where it's almost not there, and that's the hurricane peak month, where we know that the trade winds are at a low level and that it's a lot hotter on the island. But yes, the temperature, yes, the trade winds, all of these things, the fact that we live outside and we communicate mostly outside, that we're not like in moderate temperature countries that live inside most of the time, cooped up in buildings, lots of people on top of each other, these factors help us. And so if we look at what are the actual goings on of the virus on our island, It isn't necessary to impose additional measures on people if we already manage to keep the transmission low and there's no transmission to speak of on the island.
But what about the visitors, the people, because now we open our border.
Yes. Now it becomes something else. Now you're talking about, and you are asking that on the airport, for example, in confined areas where you talk about closed buildings, relatively lots of people together, people coming in from areas where the risk is slightly higher than it is with us. Yes, we are asking them to wear masks. At the airport policy is for everybody who's in the building for them to wear masks. Okay, that's fair enough. That's their policy. You can also imagine why that would work, because you're saying, well, you're all together in confined areas. If everybody wears a mask, the chance of transmission is reduced. So in that kind of circumstance, you say, yes, wear a mask, and you tell your visitors, for you, there's a difference. We don't have any local transmission, but we want you, if you're not able to maintain social distancing, if you see you're in groups of people that the contact is too much close together, if there are lots of people all together, preferably you don't mingle in there, but if you do, please wear a mask. So the onus is on the visitors to wear the mask. But we're saying there is no local transmission. There is no need to go berserk. We kept things pretty good in check. So let's try to be as normal as we can.
Because we have a case where this lady lives here. She went to do her hair, and the hairdresser, she just came back from the Netherlands. And the lady, the client, who was kind of uncomfortable having this person that just came back like 2 days before, having to do her hair and without wearing a mask. So what would you say to a person like this?
Yeah, well, we do try to tell people, of course, there is no 100% guarantee. We don't know what their profession is when they come in. We don't ask that type of question, but we do ask people that, remember, if you cannot maintain social distancing, we want you to wear a mask. Of course, that's not easy for somebody who's working all day to keep that mask on, I understand. But it is a requirement that we're asking people to adhere to. Can we check on that 100% of the time? Of course not. We're not social police. The police is occupied with other stuff as well. We don't have the people and the means to be able to control if everybody's actually adhering to. We also cannot see on your face if you're a traveler that just came recently from the Netherlands or wherever, or if you didn't. So yes, and critics would say, all right, then everybody has to wear a mask. But what is the actual risk? Remember, we're opening up for countries that are at lower risk. We're not opening up for the United States, where the situation there is not okay. We're not opening up for Venezuela or Colombia or Brazil or the Dominican Republic or all these countries that are in our surroundings as well, but that have a very high risk profile. So we're trying to limit the risk of introduction of country as much as possible for only those countries who are doing very well, where the epicurve is down, where the a priori risk of you being positive when you come to the island is even further reduced because we're requiring a PCR test beforehand. So your a priori risk for people coming into the island from the countries we're allowing to is already very low. So therefore, we dare to take this risk because we know we cannot ensure that everybody would adhere to all measures anyway. But that's why we're limiting the countries from where we're allowing people to come in, and we're trying to limit the amounts so that we see what the effect is in this first month and if we can handle it or not.
Okay. Because we also have a question. It says that about the United States. I mean, they do know that there's a high number there, like you just mentioned, but what about applying some of the COVID, requirements to those people who, because you have a lot of, for example, some Americans that have houses here, that they work here. Wouldn't you open the border for them to come back and continue their work and maybe in quarantine?
If they have homes here, they have to submit an application through what's in Dutch called the reisverificatieteam, and that's a group of the people of the judicial affairs, where they know what the prerequisites are to be allowed to come in anyway, even if you're in a higher risk group area. And say, so if you're a resident on the island or if you have property, etc., it might very well be possible that they give you permission only if you come, you will be placed in quarantine. So it's not so that we're closing off. There are possibilities. You can put in a request to get exoneration to be able to come anyway. Only if you do come from a high-risk country, you will be placed in obligatory quarantine, whereby also you need to understand that the costs are for you, because it's a voluntary thing.
But they can't stay in their own house. They have to stay in a hotel.
Because if we would allow everybody to stay in their house, then we know from previous experience, because we did that in the beginning, we said, all right, voluntary quarantine at home, but 25% of the people didn't adhere to it. So imagine what would happen if 25% of the people who come from the United States, which is in a very high-risk country for us right now. So if a quarter of the people who came in don't adhere to the rules at home, and we don't have the people to control all of that. So there's not so that I have enough people to run around thousands of homes on the island to make sure that everybody's actually adhering to their 24-hour quarantine at home. So if I cannot assure that, that's the reason we put them in a hotel where we can at least be more vigilant and be more sure of that people are staying inside in a controlled environment. And we don't have the means to allow to do that elsewhere. The only ones who are making exception to is on medical grounds. So if you have a functional disability, and it is unfeasible for you to be in that hotel, yes, we will allow you to go at home, but those are limited numbers with a clear medical indication why it's not possible to have that in the hotel. But otherwise, if you can take care of yourself, and if you're mobile and there's nothing wrong with you in that sense, then the standard is that you go into obligatory secured quarantine, yes.
But people ask, why did we do open for China, for example?
Because the truth is, China is in a very good place now. Not like the very good place of Mr. Donald Trump, because it's not a very good place. But if you look at, we're using objective data. We're looking at the positivity rate. We're looking at the fact whether they have their epi curve under control, whether it's in a downward slope or not. We're looking at the total, at their testing policy. We're looking at the gross average for the last 7 days of new cases per 100,000. And we have a cutoff point at 1 per 100,000. And if you're below that, then you qualify among the same group of countries that we're looking at in the Netherlands. Therefore, Canada is on a list, China is on a list, Spain and Italy are on a list. These are countries who have gone through a severe epidemic, but have it under control and are actually doing quite better than a lot of other countries. So China is one of them. China took severe measures. They are the first one that reported the disease and had enormous outbreaks in certain regions. But right now, the situation in China is far better than Eastern Europe, than the United States, than Brazil, than many other countries.
Somebody was also asking why it's not Switzerland, because they have to come here.
Yes, look, there's always countries that you ask, well, why this one and not the other one? So could Switzerland be on the list? Yes, and they probably will be included in the next update of the list. But you have to remember, we are a small country. We just opened up the 1st of July. We purposefully kept the list limited to evaluate what does this mean? Is this small list with this maximum amount of people, is this going to create already a problem for us in terms of widespreadness of the disease or not? Because if so, we'll have to retrieve and go back to where we were and close off again. We don't want to do that. So we've been having a policy and utilizing that policy from the beginning, is step-by-step approach that we open up, see how it goes. If this works, we'll open up further. So yes, so you put a cutoff someplace, and then there's always somebody saying, well, why not Austria? Why not Switzerland? Why not, you can go on for the rest. But there's a clear reason. We want to keep it limited to make sure that we can handle it, and then we will open up further. And another update on countries is coming shortly, and there will be more countries on the list that are allowed.
Now that you said that, how many cases will we have to have here on the island for us to go back to lockdown?
Well, I hope we don't have to go back to lockdown, and it's not about how many cases. It's about whether you are capable. Look, you need to expect that if you do open up your country, for countries that in any case have, albeit slight, a higher risk of transmission than you do, that there always will be a possibility, or you're increasing the possibility of introducing the virus in your country. So will you get cases? Sure, it will happen. Do we need to lock down as soon as there's the first case or the second case or the third case or the fourth case? The answer, no. What is important is, are we able to contain? Are we able to make sure that there is no increased spread, that there is no escalation in a exponential way, that we cannot contain the spread anymore, and that it will lead to widespread local transmission, because that's a problem. If that happens, then we do have to lock down. We don't want it to go there. So it's not so that you're going to make amends on basis of 1 or 2 or 4 cases. It might be you have those 4 cases, but these are the pillars on what your policy is based on. Are you able to detect as quick as possible? Are you able to isolate the cases? And are you able to do adequate contact tracing? Because those 3 things will enable you to contain whatever outbreaks or possible outbreaks that you can get. So if you're able to do that, then there might be some cases here and there, but if that doesn't lead to widespread transmission, you don't have to revert into lockdowns.
But just say, you know, if we do, is Curacao prepared for that? Or do we, for example, if somebody comes here with that sickness, with being infected, do we send them back? Do we repatriate them? I don't like that word, but do we repatriate them, or do we keep them? What do we do?
Look, we try to avoid for people coming here that will pose a higher risk for their sake and also for ours. And why do I say that? Because they need to be informed that, look, there are rules. The rules are, if you come from a high-risk or medium-risk country, high-risk country, you're not supposed to come in because you will be placed in quarantine. The costs for those quarantine are for you. So take that into account. Don't come here thinking you're on vacation. If you do, yes, there's a slight possibility that you beat the system. But if we do find out that you're not meeting requirements, we will place you in quarantine. You'll be coming here. You won't be able to enjoy 14 days. Hopefully you'll stay longer and it doesn't matter to you. But if you're only coming for 14 days and you're going to spend all of those 14 days in quarantine, that's not a very good prospect. You need to know in advance that those are the risks that you're taking, and you will have to pay for it. Okay. The government of Curacao is not going to pay for frivolity that you took and liberty to come to try to beat the system anyway. If you do get caught, you will be placed in quarantine. Costs are yours. So we're trying to dissuade people as much as possible. Listen, of course we would like you to come in, but remember, these are the rules. If you don't abide by them, there are consequences. The consequences are for you. So we try to dissuade people to come. If you do come anyway, we will place you in quarantine. We think for practical reasons, ethical reasons maybe, that we won't be able to just put you on an airplane, get back. I don't like doing that to people. If you just traveled for 9 hours, for me to tell you, no, you can't come in, and I'm going to put you back on an airplane for another 9 hours. And but also, there are other legal issues maybe in place also. So we try to dissuade you from coming, but if you manage to come anyway, then the policy is we will put you in quarantine. You need to know this. You need to know that you're going to come up for the costs. So, am I answering your question?
Yes, you are. And I have just, bear with me, 2 more, and that's it. We recently, WHO, World Health Organization, said that they're going to do a research to see if it's true that COVID is airborne. Do you have any information on this?
I think what you mean, and this is part of the problem, is that we use different terms. I think what you mean is if there's aerosol forming, not airborne. Airborne it is. I mean, airborne is if I cough, it's also airborne, but in droplets. Now, the droplets fall down, but if I'm just coughing in your face, of course, if you're breathing, which I hope you are, because if you're not, we have a different problem. So if you're breathing and I'm coughing in your face, then of course I'm going to infect you. I mean, you know, so the other question is, does it, and when you talk about aerosol forming, you talk about also droplets, but droplets that are less, way less, and that are lighter, so they might stay in the air a little bit longer. All right. Does that play a big role in Curacao? Answer, no. Because we're outside, we have this wind, carries it away, so as long as we're outside, and our events that we organize are outside, and we're on the beach, or we walk in town, and we walk outside, and we do lots of our stuff outside, then there's not an increased risk. So for us, it doesn't really matter too much. What matters if you're not able to keep social distancing within confined areas, and if you already have lots of local transmission. But if already you prove that you don't have local transmission, it's not an issue. It becomes an issue if you have increased amount of people who are ill and that they're passing it to others, or you have people coming from elsewhere who are ill and they're passing it to others. The single most important event to try to avoid are, and that's why you see that entertainment world around the world is taking a very big hit. Because there are no big concerts, there are no big entertainment things taking place, because if there's one thing that we all agree to, that's the single most thing, even in Curacao, that you say, hold off a bit. Why is that? Because you only need one or two people who are so-called super spreaders. Now, what are super spreaders? Those are people who have the virus, they have it in a high concentration, all the way back in their throat. If you go to a major event with lots of people, where there's of course very hard music, where you need to shout to be able to hear, to talk to your partner or the people you're with, or maybe you sing along, or maybe the person that's performing has the virus and he's singing and all of the group in front of him. You only need one or two of these super spreaders and that type of environment, and certainly if it's in a closed contained area, or you can make multiple people sick. You can infect multiple people, and from them on, they on their turn can infect lots of people. So that only has to happen once or twice, and you have a devastating amount of local transmission. So those are the single most important type of events that you should try to avoid, how difficult it may be for the specific group in the entertainment. Of course, they don't like to hear this, and I understand. But if you look worldwide, that is the whole economic business area that is being affected consistently throughout the entire world.
Doctor, thank you for your time. Thank you for your patience. And hopefully next time we'll get another chance to ask you some really good questions.
Get the questions over.
Yes, yes. Thank you again.
Thank you very much. Thanks
Yeah.
for the opportunity.